Hello. Thank you to all of you who are joining us from across the country for this important conversation we are having this afternoon. It gives me great pleasure to welcome you all to the Urban Institute, albeit virtually, and to this roundtable discussion on authentic community engagement to support equity. I am Tanae Traylor, Vice President here at the Urban Institute. I focus on our Center on Nonprofits and Philanthropy and our Research to Action Lab here. But before we get started, allow me to go over a few housekeeping notes. This event is being recorded and the recording will be posted online afterward. The speaker bios are available online. You can hide captions or adjust settings with the live transcript button. And all participants are muted, but you can type your questions or comments in the Q&A box at any time. Please take 1 to 2 minutes to complete the survey at the end of the event. We want to hear from you. We welcome your feedback. Lastly, engage with us online using the hashtag #LiveAtUrban. Today's event is part of our American Transformation Project under the direction of Faith Mitchell, Institute Fellow in our Center on Nonprofits and Philanthropy and our Health Policy Center here. The American Transformation Project, I'll refer to it as ATP, is a research program here at Urban designed to advance racial equity and dismantle structural racism with the focus on Black, Latino, Native American, and Asian young people in the US. ATP leverages the Urban Institute's research capacities to inform funder practices in 4 key areas: education, employment, justice, and healthy development. By combining substantive research knowledge with the expertise of leaders in practice, advising, and strategy, we aim to convene a lively community of engaged, forward-looking partners who envision an equal future for America's young people. Urban is so excited about this program and excited to be convening you all here today. We believe that Generation Z will help lead the nation toward a future where a person's race, ethnicity, socioeconomic status do not determine one's life outcomes. We are excited to help them build that future. As we begin our event today, I want to take an opportunity to share a bit more about the Center on Nonprofits and Philanthropy and our Research to Action Lab. First, the Center on Nonprofits and Philanthropy. CNP has been with us for more than 20 years and has been a critical resource for credible, nonpartisan, and accessible data insights on nonprofit and philanthropic activity in society. And while we hope to continue to be a trusted source, we also know the field is evolving and growing. The number of registered nonprofits continue to increase each year, and giving also is increasing. But for us, we look at to what end is it increasing? We're looking at big picture issues here at CNP, exploring questions like, what are the supports and services that the social sector needs to thrive? And how well does this infrastructure ecosystem accomplish that goal? We've recently also released a new report on philanthropic pluralism, examining the historical implications of giving in American society. We're exploring ways to deepen our presence in place, starting with the American South. Our Research to Action Lab launched in 2015 and leverages the breadth and depth of Urban's research and development of new strategies. We create actionable tools and analysis and offer data-driven support for leaders all across the sectors. We have a team of more than 40 staff grounded in the best available research and evidence to promote ways to center equity. We seek to understand the partners, collaborators, and clients' needs and provide tailored support to ensure our products, recommendations are tangible and actionable. Our work includes more than 20 national efforts delivering policy research and translation, strategic advising, training and technical assistance, strategic convening, and institutional program management that leverages the breadth of expertise that's here at Urban. Lastly, we collectively foster sector and community enrichment. We provide organizational and community-driven advising and support to equip our change makers like you with actionable and practical tools for innovation and impact. similar to this convening we are hosting today. Our format today is a panel discussion moderated by Rashid Mosley, who is our Senior Policy Program Manager in our Center on Nonprofits and Philanthropy. He'll be joined by an esteemed panel. He'll be joined by Elsa Falkenberger, who is our Principal Research Associate at Urban and Director of our Community Engaged Resource Center. Edwina Jackson, who is President and CEO of Impact Counseling and Consulting in Columbia, South Carolina. And Lauren A. Smith, who is the Health Equity and Strategy Officer at the CDC Foundation in Atlanta, Georgia. Admittedly, I'm really excited about this Southern presence. Elsa, Edwina, and Lauren all have rich experience working with communities to support equity, as does Roth. Together, they will discuss how solutions designed in collaboration with communities can shift power, change systems, and advance racial equity. And they will share innovative strategies for centering communities, approaches for generating meaningful and sustainable engagement, and proven methods and practices for translating research into tools and action. Today's conversation is about how we employ narrative and numbers to positively change the lives of people of color in our communities. So today, we hope you are reminded by Dr. King's words that we are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all of us indirectly. Thank you for joining us. I'd like to welcome Rob Mosley.
Hello, and thank you, Tanae. I would like for our panelists to join Elsa, Edwina, and Lauren. Welcome you to turn your cameras on. All right, thank you and welcome. So let's jump right in. Authentic community engagement to support equity. That's a mouthful and it's a humongous goal. So first we want to start with breaking that down and sort of unpacking what that means. I'll start with Edwina. If you could help us think about how you define communities. Are you able to unmute? I'm still not able to. Can anyone hear? Yes, try it now.
Make sure your phone.
Yes, yes. So how do you define communities?
Oh, thank you, Dr. Ross. Well, I would like to bring to this conversation, that disparities in health exist by geographical areas, as many Americans living in the rural communities lack access to primary care, available professional staff and competent providers, lack of insurance, transportation, and much more. So my definition of community is defined by a group of people who live in a specific geographical area called rural, who collectively experience challenges with accessing health care.
All right, thank you. And considering your definition, or rather considering her definition of communities, Elsa, if you could help us think about how you talk about your work when you describe authentic engagement with those communities and how you define communities.
Sure. So a lot of the work that we do at Urban is sometimes place-based, geography-based, but also can be quite national. So we spend a lot of time answering that question and asking it of ourselves. And there are certainly even more ways, but to boil it down simply, we often think about community as defined by identity, by geography, by experience, but it can also be aspirational qualities that bring people together and bind them together in what they consider community. I also want to point out that these different experiences and identities are intersectional. People don't live a single experience, geography, or any of the other factors that I mentioned. And we often also think of community in the resident and non-professional sense, but also really important to recognize that many of us as professionals bring our own lived experience and vice versa. So just recognizing that it can also be quite complex and beautiful in that sense. In terms of authenticity, not an easy one to define, but I will say you know it when you see it, and it looks like trust. So if I had to boil it down to one word, I would say that. And also say that for authenticity purposes, it's also really important to think, to recognize that even community engagement work can sometimes end up being extractive. And so if we're really looking to remain true to the ethical and grounding for this work, that keeping in mind why we're doing this work is extremely important to ensuring that we're not just doing more engagement for the sake of extracting information, but doing the engagement for the sake of power shifting, for investing in communities, and for the benefit of communities.
All right,
Yeah.
thank you.
Ron, could I just pull on that thread just real quickly? Because
Yes.
several things that Edwina and Elsa said resonated with me. One is around the definition of community. I agree with, can concur with the ways you described it. One sort of friendly amendment might be that sometimes communities can be identified not only by their geography or aspects of their identity or experience, but also sort of their shared attitudes, their interests, their goals, what they're looking to sort of achieve. And so just wanted to say that I feel like as we talk about community, we will undoubtedly be having a flexible and broad sort of sense of what community can mean. So that was one thing. And then on the authenticity thing, Elsa, that you were saying, you said, well, you know it when you see it, and it looks like trust. I would say it looks like trust, and it looks like something that's mutually beneficial and mutually respectful. And then you got right to the heart of it, which is around power and how that's acknowledged and shared. So totally agree with that.
All right, thank you. So Lauren, let's go from there, and I want to sort of extend that. Recently, organizations and groups have been more explicit about their work around equitable practices. As we're thinking about particular engagement, community engagement, and particular communities of color, can you sort of talk about how you're thinking about equity when we talk about that authentic engagement? And does that look different than how we used to talk about community engagement?
Well, it's interesting. I think it's a great question, because in my mind, equity as the broad concept is intrinsically intertwined with the whole idea of authentic community engagement. Like I don't think you can have one without the other. And when I think about community engagement, and I'd love for Edwina and Elsa to jump in, there's not one way of doing it, and there's not one sort of characteristic of it. It can morph over time. A given relationship might have different characteristics over time, or the same entities might have different levels of engagement on different topics or different sort of issue areas. So it's not a static or unidimensional, one-dimensional way of thinking about it. And I like to use at the foundation, we've been really trying to dig into this idea of there being a spectrum of community engagement with on one end, the idea of informing. We say a health department might tell you what we're doing, or we'll share with you what our plans are, but it's kind of a one direction kind of information flow. Over to consult, where we might ask for your opinion on something, but it's something that we've already sort of maybe discovered or designed. And then there's the involve. The third one would be involve, like really sort of in a more partnership kind of way, gather and sort of tap into the expertise and knowledge and experiences also that you were just talking about that folks can bring. And then even a higher level than that would be, or more involved in that than is collaborative. Like when you're collaborating, you're not just involving someone, but you're really, tapping in a deeper way. And finally, the level of deferring to, like sort of more fully shifting the power for deciding and acting to the community. And so we can get back into this, but I think it's important to recognize that there is sort of a spectrum of, it might have different terms for it, but the idea that there's different characteristics of community engagement, and any one community is going to be probably working at different points in that spectrum with different partners, or with the same partner at different times.
Thank you. And so before we move on to the
I would-
next set of questions, Dr. Jackson, I was going to ask you to speak and I have a specific question for you. Go ahead.
Okay. Well, I would like to talk about, authentic engagement in the sense of more micro. And when you talk about it in forming collaborative relationships, and I'd first like to explain that concept by utilizing a metaphor that I love, and it's called boots on the ground. And that metaphor is a term I use to utilize to bring the concept home that boots on the ground is a process that consists of working in the trenches or getting in the field with the community members. And you do this by drawing on existing relationships that you already have in the community, but also it helps with fostering new relationships by requiring tapping into the values, the hopes, and the expectations of the community members. And it's an adequate place to start would be with the leaders who are assigned to a position. Like, for example, a community religious leader or a barbershop owner or the school principal. This is how we formulate collaboratives. I'd also like to add, just that lens, a specific lens when you're working with collaboratives and engaging with communities, is to have a strengths-based perspective. A way of working with the community that focuses on the community strengths and the assets rather than on the deficits or problems. You got to remember that community members get bombarded with hearing the negative aspects and the statistical data related to their area. This is a place they call home where they live and breathe and have their children. And so this is a perspective is to build on the work that communities are already doing. The goal of this perspective is not to deny the problems, but rather based on the question of what strengths and assets of the community can be identified, built upon, and directed toward resolving local challenges with equity. So, looking at that lens, that strengths-based perspective lens, and also utilizing that metaphor of boots on the ground, as we have to get in the trenches and build those collaborative relationships to assist with the engagement with our communities.
All right, thank you. And Dr. Jackson, I just want to elaborate one more part about the equity. Now that, as I said recently, that's been more of a stated goal, although most of them have been doing this work for years, understood had to be equitable, but now that's more of a stated goal. How does that automatic statement or, telling communities that you're there looking at work from an equity lens, you are focusing on equity, how does that play into how you work with these communities, particularly those residents that you talked about?
Well, the lens as well as the boots on the ground, that individual perspective builds into that equity because you are working in partnership with the community. You're not coming in as the expert. You're looking together as to co-learn and learn from one another, that you bring your strengths and resources and knowledge and skills. And as a scholar practitioner, we're bringing that information as well. And so that looks as a partnership. And then when you walk away from a community, they don't feel like, we as researchers came in to work with them, but yet you left them with skills that they can utilize forever when working in the future with other projects.
All right, thank you. And Elsa, I have a question for you, and it's sort of connecting to what Edwina said, but I just want to add on to it. When we're working with those community residents at the local level, and we're thinking about compensating community members for the time that they spend with us, we're on the clock. We're getting paid for that. Can you talk to us about how do you think about this, and while you're keeping your eye not on jeopardizing anyone's benefit, but you also offering compensation?
Sure. So actually one of the, maybe not the first, but one of the first things I try to do when I enter a community is exercise what we sometimes call positionality. So making sure that, especially if I'm not a member of the community, being really upfront about that. And part of that is I'm getting paid to be here. My career is based off of this work that I do. I not only get paid, I have benefits. And so making sure that I'm upfront about that, and also state really explicitly my intentions, period, but also my intentions to bring resources to the community and to follow the lead and the priorities set forth by the community members and community leaders. Part of that commitment is financial commitment. When possible, hiring folks directly from the community creating community advisory boards. Sometimes it's deeper and more ongoing work, and sometimes it's shorter term. In terms of compensation, especially when it comes to people's benefits or to other, whether it's housing or programs that they participate in that have income parameters, to respect people's autonomy and their own decision-making power, I think the best is to offer full transparency and to say, we understand and are very sensitive to the fact that we do not want your engagement with us to affect these things that you rely on in your life. This is the amount of money that that at the moment we're prepared to offer. We would like to open the door to discussion over what that means to you, if you feel that that's enough, or if you think that this might affect you in other ways. And there are always, of course, my priority is always to get people paid financially. If they, for whatever reason it is, feel that they need to receive something in kind, and that can be a lot of different things, then that's something that we're certainly open to. But I think the best is to offer full honesty and also support through that decision-making process. If they would like to consult with somebody who may often not be me, who can help them through that decision-making process and make sure they're actually aware, not just afraid or or hesitant because of what they think might happen, we'll find the right person to help them make that decision.
Thank you. And I want to open it up to all the panelists. I want to add on the work around the compensation, really think about co-design. So in addition to not just flying into a city, asking a bunch of questions and flying home, we talked about the compensation, but from your experience, what are some of the strategies for co-designing solutions alongside these communities? And what have you found to be most effective? And either one of you can start. Lauren?
Yeah,
Okay.
well, I would say, we've both Edwina and Elsa have already sort of alluded to some of these, but one is, I think there's an acknowledgement piece. There's sort of an upfront, I think you called it positionality, but an upfront acknowledgement of what's come before. There's oftentimes a reckoning, or at least an acknowledgement that has to happen, that the conversation that you want to have, or the discussion you want to have, isn't happening in a vacuum, because something's happened before. Undoubtedly, people have, folks have been in the community before. And how did that go? What are the bad or not great tastes that may have been left? And, what is that about? And how can you acknowledge and recognize that? So I think that that's one important piece. The other is, making sure that as someone who's coming into partner, that you are in fact ready to partner in the authentic way that folks are talking about. So that requires some introspection and really to do a rigorous, I think, self-assessment, like, am I ready to share power? Am I ready to acknowledge and recognize other kinds of expertise that aren't necessarily academic credentials or what have you? So I think that self-assessment and that self-check for readiness is also really important. And then the last thing I would say, because I know that the panelists have lots that they will add, is around an appetite and a discipline around patience and time, that these kinds of efforts aren't necessarily in a 6-month grant period, right? You can't get to the trust and the relationship building in a really short period of time. And so you have to be willing to show up and be where people are, to sort of be trustworthy. People always talk about like gaining trust, that others will say, well, no, you have to be trustworthy. And so part of being trustworthy is, being in the space. Like I said, doing the sort of acknowledgement of what may have come before, what missteps may have happened, whether or not they were yours or someone else's. And then being willing to listen and understand the prioritization, the priorities that are coming from the community. I think, the adage, like you have 2 ears and 1 mouth, and you should use them in that proportion. I think that that's really true. And so people can position themselves to listen at least twice as much as they're talking. I think that's really important. So
All right,
I'll
thank
be
you.
there.
Thank you. Edwina? Same.
I'd like to talk a little bit about, once the stakeholders have come together and convened, we have to pivot and analyze that group dynamic, which exists when the researcher and the stakeholders come together. And some of those aspects that we need to really look at is the community context, as well as the stakeholders' engagement themselves. Like what are they? How committed are they? How committed are they? What is their skill level, and what is the leadership abilities within that specific community, so that we can, when we walk away, we understand that we have to put up a plan together that will allow them to be committed to, and we can utilize the skills that they have. I think we also have to look at equal decision making and learning from one another when we're working together with the community. And we also have to look at the community's context. What is going on within that community? What's going on in the political state of the community? What's going on in the environment? Real time is what I hear communities always say to me. We need to be aware of what's going on in real time is what they always say to me. And what I mean by that is, like, for example, when I was working with one particular community, it was a political time of the year, and working with the rural community, they would say, well, listen, the Democratic Party's on, we can't have a meeting tonight. And that's working with the community in real time, being open to what is going on a daily basis. I remember we were having some technology challenges one time, and one of the members said, listen, we had some work done in the community, and they burst the pipe. And so it knocked out a whole power line. Well, that being the case, as researchers, we got to be involved in what's going on in the community at real time, as well as the knowledge that we bring into the community from our stats and what we read. So, being involved with the community at real time, engaging with them and seeing what their commitment level is, their skills, and their leadership is as well.
All right, thank you. Elsa, did you want to add to that?
No, I think they both put it perfectly.
Okay, thank you. So I'll sort of shift. We've talked about what designs you've sort of seen that have been most effective. Can you all talk about any of the barriers that you experienced or encountered? And two parts to that. In addition to the barriers, how did you handle them, and where did you leave the community? And I'll give you all a moment to sort of think about that. So any of the activities that you've had in the past, and we all run into barriers when we're working with local communities. Edwina, you want to start?
Yeah, I just want to start with, because since I just kind of ended with a little bit about barriers and challenges that the community was experiencing, and I was trying to give some examples in regards to that. I would say one barrier is the mindset of the community. And a specific example would be is that I had a group of community members say that, you as researchers come into our community and do projects on us, and then you leave and we never see you again. I had another community member say that, I don't want you to come here and put together a health fair and then bring all these healthcare providers, and then you leave and we never see you all again. So we have to change that mindset of our community members by engaging them more in the process, so that when we do, as researchers, walk away, we've left them with skills and knowledge and plans that they could utilize and can continue to move forward with, and establish relationships with them, with the people we actually bring to them. And it's not like a one-time thing. So one thing is changing that mindset. Another thing I would say is we have to gravitate towards alternative forms of support for trust, such as their churches, anyone that they trust within the community. We have to gravitate towards that more and build upon that, because then in return, the community will trust us because they trust the actual people that we're working with. And so I think that changing that mindset, and then being more mindful of who we're actually engaging with when we're in the community.
All right, thank you. And Elsa, I want to sort of jump on where Edwina left off and ask you a question. As we think about our professional roles as researchers, and for many of us, that's an end product. However, the communities that we're working with is just a tool used to get to where the community want to go. So how do we sort of have that balance between us as researchers shifting our focus as researchers, the end product, and working with communities where it's just a tool that they use to answer any questions they have, is that product. And what do we as researchers and research organizations gain from changing that shift? Is it a paradigm shift? What do we actually lose? Or do we lose anything if we sort of shift the work of researchers to publish and to post, and it's a product, and that's not where the communities are?
Ooh. I would say, it's not a zero-sum game. There's not winning and losing and as a starting point. I generally think we've been missing a lot of the value that is critical from deep, authentic community engagement. And so we only have to gain from that. I do think that people sometimes feel threatened by it, by thinking, does this mean that the work that I conducted before wasn't high enough quality? And we really get stuck in that defensive space sometimes, particularly as researchers. I think the point is it's another extremely valid source of expertise that has been deeply missing from the table for a very long time. And not always and consistently, right? But across the board. And so I think really looking at what is it that we have to gain. I also think that besides the place of defensiveness, a lot of times people come at this work with a risk mentality. What are the risks? And certainly there are challenges that, Dr. Jackson was just mentioning, and there are risks always. But I think that this work really requires that we think aspirationally, that we look at the value that we've been missing. That's really necessary. And just to add on to one thing that was said before, in terms of the barriers, and I don't say this in like a flippant kind of way, but the first barriers are often ourselves or our institutions. And I think that in order to do this work, it means doing something differently. It means pushing against the way things are done routinely. And this is not just a shift in our research questions or even in our methodologies that we're writing up. It's a shift in how we work. How are we contracting with people, right? How do we define and how do we even create a rate that justifies lived experience, right? All of these things take a lot of internal work on our institutions. It's a lot of power shifting, which we know can be very challenging at an institutional level, but also at a personal level. So just lifting those up as well.
All right, thank you. And so far we've talked about two particular groups, the communities that we work with, and also from the research aspect, that also takes funding. And so I'm sort of thinking about my former role as a funder. And so Lauren, I want to sort of shift this to you. From funded organizations, their perspective, been interested in actually prioritizing this sort of authentic work. What are some of the strategies or objectives or considerations that funders should consider when they think about how they evaluate groups or researchers who say they want to do this work? And are they truly committed to it? Are the community truly committed to it? So can you speak to more from that side of some of the considerations that should be made?
It's a really tremendous question. And I think this allows us to get into the issue of sometimes the discrepancy, or I would say the gap between what our aspirational goals are that we might have as institutions and organizations, and then getting to what Elsa was talking about. What are our internal structures and organizational structures, and what do they promote or inhibit? And so I think in terms of this, a new and different way of working, right, there's a whole field of trust-based philanthropy that folks are exploring and diving into that has to do with decreasing administrative burden on folks who might be applying for grants, having a different assessment like we talked about in terms of what expertise was, co-developing what the measures of success are, right? I mean, even that aspect of power, like, me as a funder, if I'm telling a community, well, this is what we think the measures of success are, versus co-developing that. Well, what would success look like for you? Like, what would be meaningful for you, right? So that's an example you talked about of co-design. Like there's an example of co-design in terms of the metrics, co-design of language, shared language. So, you know, some of the successes that we've seen is where people take time to literally come up with a shared vocabulary and shared glossary of like, when we say X, this is what we mean, and making sure people are like, you know, literally and figuratively speaking the same language. So, and again, back to what we were talking about before, all that sort of takes time. That's not you know, quick, you know, fill out this quick form. So I think it's the time and sort of the recognition that we need to do things differently. And that's why I was trying to stress that readiness piece, and that, you know, is there an appetite for trying to do things, being willing to do things differently? Because a lot of times, frankly, we get used to our own habits and we're not even aware, or we're not conscious of how the habits we have are may not be serving us well, but they're invisible to us because they're habits, and we don't even sort of think about it. Our assumptions around, you know, what kind of documentation is necessary, what kind of vetting process is necessary, for example, for funding partnerships.
Thank you. And Laura, I want to, Elsa, I want to direct this question to you, sort of jumping off where Lauren ended. As organizations that are receiving funding to do work in communities and sort of sitting in that in-between space, how does sitting in that space impact methods or the methodology that you laid out, that you sort of described you wanted to do, and sort of that balance that Lauren talked about, and then add into it, Edwina talked about it, working with the local community people. How does that impact or change any methods, or should it?
Sure. Well, I think for those of us who sit in that in-between space, as you put it, it comes back to what I was talking about before, the grounding for why we do the work. And if we're not grounded in the ethical reasons, that will end up being extractive again. Same thing again. If we're grounded in wanting to generate value and prioritize the visions that the community has for itself, that's our priority. And of course, there are always requirements or restrictions or challenges that come with different sources of funding. Sometimes they're not flexible enough. The community is happy to talk to you and wants to talk to you about food insecurity, but another form of safety is gun violence, and they don't experience those in silos one day versus the next, right? And some of our funding can be really restrictive in that way. Sometimes even just pragmatically, some funding doesn't allow you to purchase food. Nobody's ever done any community engagement without bringing some food to the table. So there are, you know, some things are just very practical and others are larger. But I think that our job as researchers who want to do, as researchers and as policymakers, as practitioners, as members in the government who are trying to do this kind of work in lockstep with the community, is to remember where your priorities are. And to make your decisions based on that, of course, and then to be transparent. When you absolutely first be transparent about where you are able to go and where you're not able to go, but also at the same time, not always relying on that, I can't, these are the rules and regulations, right? There are laws, and then there are rules and regulations, which can always be shifted and amended with some effort, sometimes more effort than others. But really having to take that as part of your responsibility to think about, where can I push? Where can I innovate? Where can I ask for more in order to be in service of the community and with the community? And I think a lot of times we are, as especially researchers, some serious rule followers, tend to just go with the status quo, expecting that that's how it has to happen. But often there is a lot of space for innovation and change. Just takes some effort.
Thank you. And when we started, we had this conversation around trust, and that could be one of the barriers of working with communities as researchers. Could any of you elaborate on any conversations you've had around power, where community members did not either want to be involved in the process? We've talked about before, so there's extractive, people fly in, do research and fly out, and there's this power shift at the local level of, we don't think things are going to change. The power doesn't, we don't believe the power lies at our seat as community members. So it has power, and how does understanding power connect with the work of really being authentic as you're asking these questions and co-designing with these community residents or organizations?
Well, I think I've heard both the panelists talk about the phenomenon of a weariness or fatigue in many communities, so that which may then be interpreted as a lack of interest in participating, or a lack of interest in leading, or a lack of interest in being engaged, when really it's a reflection of a cumulative disappointment or frustration with how things have gone before. That's why, I was talking about like what's happened before, like what's the reckoning and the acknowledgement of what's come before. In my mind, that's about showing up differently, and having to be able to demonstrate that this might be different, and how and from the very way you do it, from where you meet, from the time, the meetings, who gets to decide, whose convenience is elevated, is it at a hospital research, is it someplace that's easy for community members, all those sorts of things. People can get a sense if this is going to have a different feel to it.
Right. Thank you. Any other panelists? So I want to sort of shift to what works. So if the three of you could think about an example of a community engagement project that you want to share, and really one that is sort of shifted, assisted with systems change. And so I give you a moment to sort of reflect. Elsa, and then Edwina, and then Lauren. If you could share a success, particularly at a systems change level.
Sure. I'd actually like to give an example that's not my own and that I cannot take credit for. More as models for how this work, where I would go if I was saying I would like to have the best example possible in front of me, even recognizing if that's not where I'm going to be able to start. And I think there are two communities that are great champions for and serve as leaders for us in this work. One is tribal communities, and the other is the disability community. I think a lot of people are familiar and sometimes don't always attribute to the disability community the nothing about us without us statement. And with tribal communities, they don't talk about community engagement, they talk about sovereignty, right? So if we're really talking about power shifting, as from input provision to really power shifting as being the spectrum of community engagement, there are some really incredible examples out there that are about that decision-making process, about the power to make decisions in your own community, and about how that should look and all of the intricacies. And so I would really, I would point to those two examples very broadly in terms of systems change.
All right, thank you.
I would like to give tribute to the rural communities, and that community action plays a vital role in affecting sustainable change. And one effective strategy or design that I utilized was working with a community to improve their health and wellness was the community action plan. And it was a design that was built out of the need to have a workable plan. And this particular workable plan was realistic and tangible for the community to work through. And I can't take credit for that plan because the community actually put that plan together. They still utilize that plan. And when you can create strategies like a community action plan that you can lead with a community, then that power shift changes because they created it, they were involved in all pieces and all steps of the process, and you leave them with that product that they can continue to work on and use as they build more resources or supports for their community. So I just think that that rural communities have such big support, and that if you work with them in a manner that that they can understand and make things more realistic and put them in smaller steps in some situations, then you can walk away with a bigger product that will allow them to be able to utilize long term.
All right, thank you.
I can give it an example of a project, a power building model for community violence prevention that we've been, the foundation's been working on with Human Impact Partners and Health Resources in Action, HRIA. And this really involves 4 cities where there's coalitions: Boston, Milwaukee, Atlanta, and Oakland. And in all 4 of those cities, there are coalitions of groups that have come together for in-person convenings and sharing around, the power building and power sharing models to do exactly what you were talking about, to build in and accentuate and enhance the capacity in those areas to be able to address violence prevention. That will that capacity and infrastructure will stay in the community after the project is over. So they've done sort of workshops, convenings, et cetera, and which have been really well received and appreciated. And that project is ongoing, it's happening now. But I think it's a good model for being able to be in community in a way that each of those communities are developing their own sort of priorities and sort of actions, but there's a cohort or opportunity to sort of have peer connections that people find useful. So that's a quick example.
All right, thank you. And Elsa, I want to go back to you. Do you have any specific examples of a tribal community that you were thinking of?
Yes, and I actually dropped a few of those links in the Q&A really quickly because I realized that like a very broad brush. There is one that I mentioned that is specifically about data sovereignty, which I know was another area of interest. It's called OCAP. So folks look for that in the Q&A. And there are lots of other resources we promised to answer to. These are incredible questions that are coming through that we won't have time for all of these, but we will make sure that we share a lot of additional resources. I also wanted to flag that a lot of things that have been coming up are around like compensation, positionality, preparing for this work, good partnership, how to share data authentically. And we do have a number of different community engaged methods toolkits, and we'll make sure that we share that link as well.
Okay, thank you.
And just on that line real quickly, I'll see if I can walk and chew gum and put it in the Q&A, but the foundation has sort of coalesced or compiled some principles, a set of principles around data equity applied to the entire data lifecycle from the beginning of research conception, how questions are even sort of generated, through how you think about gathering information and the important stages that folks have been talking about around the bringing that information back, doing meaning making in collaboration with the community. Like, this is what we've found. How does it land with you? How does it resonate? What would you say this means? All the way to the dissemination. So I'm happy to try to put that in the chat as well, because I think that might be a helpful resource.
All right, thank you.
I think another helpful resource too is the community-based participatory research approach. It has like 9 different steps that is very helpful with bringing the community together as a unit and building upon their strengths and facilitating collaboration and empowering them throughout the process and promoting co-learning and integrating knowledge and actions and working through a circular process, and then also ways to disseminate the information from the research that you receive.
So Edwin, I want to go there when you're talking about when we're working with these communities and researchers are not necessarily from those communities. How do we think about, or what are some of the methods you talk about, the community-based participatory method of researchers effectively integrating themselves in those communities understanding all of the policies, all of the complex nuances, the historical context? What are some methods of researchers who are sort of quote unquote outside of the community, not from here, that they could sort of engage in when they work with these communities?
That's a very thorough question, Dr. Ra. Can you ask me that last piece of that question again?
Sure. So you're working in a community, or a community is interested in working with you, and you live 4 hours away, 5 hours away. And how do you help them understand that your goal as a researcher is to really support their needs, and yet you're sort of met with not necessarily resistance with this conversation, but you're not from here. You don't know how we operate. That's not how we do things. And so what are some of the strategies that researchers could sort of take to help integrate themselves into those communities?
I think one particular thing that's very important, and I think we've honed on that a lot throughout our conversation as well, is understanding the community context. You know, what is special about this particular community. And I think also, you know, understanding some of the strategies that have been used before in the past that were successful and or either were not successful, and acknowledging that with the community, being open-minded and listening to the community. I think communication is so important when working with communities, and you know, taking ownership of a strategy that did not work. I think that in being transparent with the community members and accepting that maybe one particular strategy did not work helped me as a researcher modify this strategy so it can better help your community and any other community that we try to utilize it in. And I think that's where that transparency comes in. So understanding the community context, looking at other strategies that have not worked, and, you know, of course, going back to the assets and the strengths of the community. I think formulating relationships is so important when you talk about the positive pieces of a community. What do they already have that's going well for them with their transportation, with their networking system, with the people that they already have coming into the community? What do they already have that's working well, and how can we build upon that? I think when you do that, then you can build that relationship with the community, and it's not a we versus us. It's we are a team. So I think that's how it's easier to integrate yourself within a community, is that you join with the community and you acknowledge what has and has not gone well, and you help them, let you modify it, and then you move forward with how we're going to be able to work together in partnership.
All right, thank you. Elsa, do you want to add to that?
No, honestly, I feel like that was a great answer.
All right, Lauren, any additional? And I have a second question for you, Lauren. No additional. So earlier we talked about power, and so it's one perspective of the relationship between the researchers and the communities. And we talked about the communities of some sort of being reluctant. Change has not occurred the way either the researcher promised, it was written about and moved on. And when groups have met with sort of policymakers, and going back to the conversation of community engagement, how do we help policymakers understand community engagement is more, and I sort of put it as sort of one of the guests recommended, it's more than just a listening session. So that we've now engaged our community because we had a 15-minute listening session with the elected official. Therefore, that's authentic and the community is engaged and we understand their needs. How do we, as researchers particularly, address that, as I say, sitting in between sort of the sponsor, the funder, the reporting group, and the community?
That's a really good question, but I think it could come back to where we started, which is, you know, thinking about that spectrum that we've been talking about, because there's subtle messages that are, or not, maybe not even subtle messages that are being conveyed depending on, you know, where you are, right? So if you're, you know, doing the informed thing, you're saying, okay, we'll let you know sort of what happens. when you're doing the consulting thing, it's like, well, we care what you think and we want to understand more. If we do the involved piece, it's around, you're making us think differently, and we're willing to, we're not just willing, we're interested in sort of thinking differently, and you're having an influence on us. And the collaborate, which I think, Edwina, you were talking about, your leadership and expertise are critical or are essential. So those subtle messages that are underneath how you're choosing to engage is where I would come to those folks and say, if you're only doing the listening sessions or the informing, like this is what we're planning, the message you're conveying is this. Is that the message that you want to convey? If so, don't be surprised if you don't get the result that you're looking for.
All right, thank you. Edwina, Elsa?
I know we're short on time, so I'll be brief, but I'll say one way to kind of bring people along on that journey is to show, not tell, and also provide examples and tools. So I would say one of the things where we've seen a lot of success is in doing data walks or data interactives, where you really dismantle that power dynamic of who's the expert in the room. People are traveling through data, pictures, images, different things together in groups that have different sources of expertise, and co-analyzing together, co-developing their solutions or future questions. And that's really an opportunity for folks who are typically in their professional positions, used to being the experts in the room, seeing the value in that kind of co-design shared process.
All right. And now we're close to time. I have one more question, in particular around research. We think about dissemination, and there are different ways of disseminating what we've learned. I'll ask all three of you to sort of think about dissemination in a way that supports engagement, a continuous engagement. And I'll leave it there. So what are your thoughts on dissemination, but also with that leading towards a continuous engagement?
I just get excited about a particular the table talk that I'm currently doing with our agency. And that table talk, I cannot take credit from it at all. And it is a different type of way to disseminate information that you to the community in regards to what was learned throughout the research process. But it's also a way to stay in the community and continue on working with them by educating them. And the particular table talk that our agency does is in regards to healthcare. And so that allows the community to continue to stay involved with what's coming up new with healthcare, what this particular month is about healthcare. What are we talking about healthcare with this particular month? Bring on healthcare providers, healthcare organizations, and then they're also always getting fed more and more information, and that can be part of their community. And then also community members are part of this table talk. So, and they help with the selection of the topics. So I think that's a good way to disseminate the information, but it's also a good way to stay within the community and share what you learn throughout the process, putting it in action. That's what communities want us to do, is put what we have done in action and stay with them.
All right, thank you. And I see we're at time. So on behalf of the Urban Institute, our Centers of Nonprofit and Philanthropy, and the lab, I want to thank our guests, Lauren Smith, Edwina Jackson, and Elsa Falkenberger, and all of our attendees today. If you have a moment, please take time to go into our survey. We hope you enjoyed this conversation around authentic community engagement, and specifically in supporting equity. Thank you again, everyone, and enjoy the rest of your day.
Thank you for having me.